We are here to talk about some special issues with the team, a little part of the biggest team from Julius Institute. First of all, I would like you to present yourself, introduce yourself. Is better than me. Could you start? Yeah.
My name is Kirsten Visser. I'm from the Netherlands, Rotterdam, and I'm a PhD student working with adolescents with ASD, doing research, and I'm also a psychologist.
My name is Linda Dekker, and I'm also a PhD student at Julius and the Erasmus MC, and I also study adolescents with ASD and their psychosexual development.
My name is Athanasius Maras. I'm a child and adolescent psychiatrist and psychotherapist, as well general psychiatrist. I'm director of the Julius Academy, which is responsible for research, innovation and education of our whole institute, Julius Mental Health Organization in the Netherlands. And I'm a member of PICA. I'm very proud to be here, and it's a pleasure to be invited. Thank you very much.
And I'm Chris Kuiper. I'm board member of Horizon. Horizon is an organization for youth care and special education. And my special topics are research and development, especially on autonomy and participation. And besides, I'm a professor at the University of Applied Science in Rotterdam.
I am Sueli Cabral Hudson. I am a child and adolescent psychiatrist, and now I am the technical coordination from PICA. Professor Mas, could you tell us about the prevalence of autism in the world nowadays?
Prevalence in the last 10 years changed strongly. 10 years ago we thought it is maybe 4 out of 10,000 children. But nowadays we know that the spectrum of autism is broader, and there are many children and adolescents, even adults, who suffer from autism, from any type of autism. We are talking about almost 1% of the whole population who has some autism spectrum disorder. Of course, the severe form is maybe 10% of this group, but it is quite common, so not to underestimate. It is a huge population in each country of the world, and we know that mainly in childhood and adolescence it plays an important role.
Do you think it's a pathology, specific pathology, or it's another kind of development syndrome?
The etiology, as it is a spectrum, the etiology is not always the same. We have a genetic background, so we know there's a familiar form of autism. That means there's a genetic cause, and it's a early brain development which is alterated even in the embryonal phase. So it's very early, and this is the main reason for the, let's say, the family form of autism. There's another type related to disturbances in the early development of the pregnancy, like mothers maybe to take some drugs or alcohol. There are other reasons like asphyxia, that means that they have not enough oxygen. So there are several reasons who can disturb the normal development of the brain. This can produce as well some autism spectrum disorder. And the third form is there are different neurogenetic forms with a clear genetic profile, and we called it neurogenetic disorders like Angelman disease, Fragile X, Joubert, and different other, even tuberous sclerosis can produce autistic symptoms, but this is more a kind of syndrome of autism. So altogether that makes that spectrum, but there's of course mainly the genetic, the familiar form, which is important.
It means that it happens early in the life, and it can disturb the normal development.
Sure. In each of the cases, it is a very early onset form. You do not develop autism when you are 21. It started really from the beginning of your life. It could be that you do not suffer from many symptoms in the beginning, so the first year or the first 2 years, it could happen that nobody would detect that you have autism, but of course at the moment social interactions play an important role in young childhood, at school and so on. More symptoms will arise and manifest, so this is important, but one thing is important. Autism is not a disorder of parenting. It is not a mistake of being wrongly educated by other people or by your own parents. It is a neurobiological form, and parents can deal with that, and they can protect their children to be dysfunctional maybe over years. But it is not a disorder which is related to the role of the parents or the environment. This is not the important issue. So nobody is guilty that their children become autistic. It is important, it's really a neurobiological disease, as some heart problems or other diseases. It's a brain disease.
But in this case, Professor Chris, how do we can deal with the autonomy, or these children and adolescents become dependent all lifelong?
Yeah, one of the most important things is some of the youngsters can cope, can deal with having autism, can learn how to behave in spite of having autism. Other youngsters have severe problems with coping with it, and then it's very important to adjust or adapt the environment, how to communicate with the kids, how to arrange with pictograms the space where he lives or she lives. So sometimes it's possible to become dependent on a structure, and sometimes youngsters can develop coping strategies to cope with the disease. And it's not that a professional should be in charge. It's very important that the child itself or his or her parents are in charge of living a meaningful life. And professionals are just coming in their lives at that moment that there is really a big problem they can't solve themselves.
Professor Mara told us about some causes, internal causes. Do you can mention another cause from the environment?
The children can have a little different behavior than most of their classmates. They follow strict rules. They do those things they think is right. And in a class, because they're not so sensitive on the humor, on relationships, they are easy bullied. So they can suffer from anxiousness, from being bullied, not because the primary cause, autism, but because the consequences of having autism.
What is the consequence of the gap between do the diagnosis till 6, 8 months to 2 years, And in Brazil, we have dates that the confirmation of the diagnosis is around 10 years, 12 years old. What's the consequence of this gap?
The consequences of waiting, starting treatment, and supporting parents and the child is that every year you start later. The more the youngster child meets problems in his life and can get frustrated. The longer you wait with, for instance, social emotional support or communication, the bigger the chances he or she will be bullied in his life. So I'm very I think it's important to start early to inform parents and to inform the child.
You know, to add something, sometimes it is really difficult before the age of 2 to exactly diagnose autism or not. You have really to be a specialist in that to find out if it is really autism or not. But it doesn't matter sometimes. You don't need a name, a title, a diagnosis, as long you can detect early problems, as long you can describe what are the problems in the development, how you can support the family, the child, then you can describe that. And you can say, okay, maybe there's a high risk of being an autistic child, yes, but we don't know it yet completely. We are not 100% sure. It doesn't matter. If you know really for sure that the child needs some special support, like getting any physical training, for example, or some support in developing the language, you have to do that because you're losing time. And every month, every day, your brain is not getting the right support, will be a problem in the future. So forget a little bit the diagnosis if you can't do that, but you have to describe, to detect early problems. This is much more important. And if you have a good team, like Paika is now going to develop, you will be able before 4 to do exactly a diagnosis, I'm sure.
It means that any time you can increase or improve the potential of these children, and the gap is not too deep in this personality or in this development. It's true because I received some children that received one diagnosis with 2 come from São Paulo, and the psychiatrist said, "Oh, it's autistic child," and we improve. He starts with the speech therapist, psychologist, occupational therapist, and after few months he become speak and try to communicate to other people he doesn't know better. And the family said, why? In São Paulo they are wrong because my son, my daughter is not autistic. They develop, they show up their his or her potentiality. And I said, that is it is the consequence. We try to not to seek the whole, but the improve the health parts of the personality. And listening to you, I noticed that the family is very important. What do you think deal with the family? Because I think they can't. We treat and we keep their children, and they become some of parents, not the total, but some are very tired, exhausted. The mother is depressed, the father they divorced, they get divorced, and the father is going out of the house.
I think we always try to involve parents in every treatment, in all phases of life. Obviously, it's suitable for the age of the child. So if the child is young, you really want to involve parents, and you try to give parents tools to handle their child, but also to stimulate social interaction with their child and to give the child more learning opportunities. So you really make the parent kind of a coach for their child to learn skills that they need. We see mostly adolescents, so a little bit older children, and in normally developing adolescents you see that they usually take a little distance from their parents, but our experience is that for adolescents with ASD, their parents are still very important also in this phase of life, and that's why we, even in treating adolescents, we try to involve parents in every step we take, and we really try to be on the same page with parents, so that if we teach something to the child and the child goes home, the parents know what we taught the child, so they will continue with that, so the child has more opportunity to generalize the knowledge and the skills into different situations.
Of course, we do one part of the treatment, and the other part the parents can delegate to anyone.
Yeah, exactly. Yeah.
And talking about sexuality, it's very delicate theme to talk with adolescents. Overall, with autistic adolescents, what kind of difficulty you find the most?
Well, what we heard mostly from clinicians was that they would show inappropriate behavior, and that inappropriate behavior really varied between asking inappropriate questions, which is rather mild, to more severe inappropriate behavior of actually being a perpetrator, violating somebody else's boundaries with respect to sexuality. And those are things that we try to discuss in the training program that has been developed to tackle those inappropriate behaviors, and to actually make sure that at the end of the training those inappropriate behaviors are decreased. But also what we know from research, and what we also now found in our own study, was that not so much on typical behavior they differ, but also in, for example, their knowledge level and skills. So what we also try to do is improve the knowledge and the skills, because we also think that knowledge is power to them, and if they have better knowledge of sexuality, they can better protect themselves from, for example, bullying, but also, for example, unwanted pregnancies, or protecting their own boundaries.
Before we talk about the more difficult topic issue about sexuality, let's remind that some people have the idea young people with autism are not interested in social relations, not in intimate relations, that they do not have feelings. This is wrong. Of course, the severe forms, they seems to live more in an own world. But there's a big group of high-functioning autistic people, young people, adolescents until young adults, who develop completely the interest in having any relation. So we are talking about a broad spectrum of getting a teenager, getting a social person, enjoying social contacts, getting friends, and sometimes even intimate relationships. This is one part of a whole spectrum, what we like to train them. So it's not simply sexuality, it is the tackling teenage time, and to prepare them to be a young adult, to be able to be a husband or a wife at home, and to care for their children. And all this means that they have to deal with many emotions, and they get training in that. And sexuality is a part of it, of course, a difficult part, but we found out that they enjoy to talk about it. If you have a good relationship to them, and Kirsten has done many treatment with 180
Adolescents, yeah. I didn't see them all
Adolescents.
myself, but that's how many we already saw for the training program that we developed. And our experience is that even though for yourself it might sometimes be difficult to talk about sexuality and those topics, if you have, just as Dr. Moreau said, if you have a good relationship with the adolescent, then it's actually easy. You just have to have the skills as a professional to be capable of talking in an autistic friendly way, because that's obviously very important. You have to be clear, and you have to illustrate, and you have to check whether the adolescent understood what you said and what you discussed. But then it works, and it's very rewarding, because obviously parents are sometimes they sometimes have barriers talking with their children about these topics. The adolescents themselves don't want to ask their parents about it, so actually everyone is happy that it happens within a safe environment.
Yeah, sexuality be a part of a social relationship.
Yeah.
Very much, yes,
Yeah.
indeed, yeah.
Yeah.
But the parents came to us because they are afraid they can't sustain, they can't deal with this kind of situation, masturbation or interest for another gender. But sometimes the difficulty is from the parents.
Yeah.
Between them or themselves.
Yeah, and I think until a certain level it's even normal for parents to be resistant with that, and also for the adolescents to be resistant talking with their parents. So if you can help the parents making the topics more discussable at the home situation, I think that's very good.
And Chris, do you think they have autonomy to get married? Because 2 years ago, they are so popular in Brazil that there was an autistic, beautiful girl, and a lawyer showed interest and fall in love with her. And in the beginning, she didn't made the correspondence, but at last she interested of him. And he proposed to get married, and the parents said no, she is not responsible for their civil acts, legal acts in the society. She can't get married. What do you say for us? Because we are lost a little bit.
Yeah. I can tell about the situation in the Netherlands.
Yeah.
Everyone who can make up his own mind is capable in making autonomous decisions, can make the decision to get married, to have children. That's an ethical problem. Most of the normal gifted, I think all of the normal gifted persons with autism can make that decision. Only those people who are probably more mental retarded, there is the difficulty of choice and autonomous choice. There's no problem, they can marry in the Netherlands, but having children is a topic of discussion. But it's only by the very low functional people who don't have the ability to make an autonomous choice. And an autonomous choice is a choice that's well informed, where you really can say you can choose yes or no. In this case, it's very obvious. The main word is yes.
Yes.
So they should be responsible for their choice and see the consequences of it. And that's an informed choice and being capable of making the choice. And in most of the situations in the Netherlands, there's no question and even no debate about it.
And actually I know many couples with one of them having autism, or even both the man and woman having autism.
Otherwise, it would not be really a genetic disease.
Yeah.
We would lost it after many thousands of years. But what we see is that parents who come to us with their child, we see often some features of autism until a full-blown diagnostic clinical picture in parents as well. Sometimes only in one of both parents, sometimes in both a little bit. That's typical. That doesn't mean that every autistic child has autistic parents, so it's not always the same, but we see it often, that some of them have some autistic features. The other thing is, what you mentioned is an important thing. There is some idea about what is autistic. So many people think that should be completely retarded young people, having no function, having no language, living in their own world, or having any special intelligence. All the pictures are possible features of autism, but this is not the classic picture. Most of our autistic patients are normal intelligent, have some skills which are better. There's a profile. Some skills are less. For example, language is sometimes less good developed, but skills in mathematics or architecture and so on is much better. So we have to understand that many people with autism have a high capability of being normal, at least, and to get a friend or a family. However, to fill in a good relationship is another thing. So we have many parents who tell us, yes, I think my husband is autistic, but I found it out some years later because he's not really involved in the family. He's not emotionally strongly linked to us. So sometimes they're a little bit surprised what happened after some years in a relationship. But they are handsome, you can trust on them, they are on time, they promise something and they will keep it. So they have many positive behaviors.
There are people with a handicap. If this handicap is not compromise his capacity to be responsible, he can get many compromise at society and to another person. Yeah.
I would only call it a handicap when it hinders your performance.
Yeah.
So most of them have symptoms, but when you can cope with your symptoms, you don't have a handicap. So I won't say all of them have a handicap.
Do you think this confusion is due the cases in the past? The first cases they found and they are doubts. It's become autistic because they are found on the forest, or they are they live for their parents live him in the forest because he's autistic. He's different. What do you think? Because it's
that's true.
It's too early in the history of autism.
You know, child and adolescent psychiatry is a kind of new science. New in that way, it exists since 100 years, but this is quite new, and we have to learn many things. In the last 20 years, we really better understand how brain is developed and how the early development can impact your later behavior. So in the beginning, it is often like this. You find cases, the most serious cases, like Kana has found this early form of autism. They describe it. But of course, even in that time, almost 100 years ago, it was Asperger who said, yes, I found same symptoms, but they have a normal language development, they have a normal intelligence. So it seems to be a spectrum. But it started with the severe cases. and people remind the severe cases. It's always the same.
Yes.
Yeah.
Yeah. And but the society react not normally. And you show us another way to look to autistic spectrum, because they can get autonomy if you can solve the symptoms. And could you talk about some symptoms who came in parallel with autism? There's another pathologies, or it's the cause of autism?
There is a core profile of symptoms, like a social emotional development process, which is disturbed. Their perception of social emotional information is sometimes retarded or has some lacking, so they don't feel sometimes very good what other people feel. They do not understand the context of a situation. Sometimes they understand things like directly. They couldn't understand maybe a joke or some sarcasm or like that. So information, additional information, is getting lost because they understand things quite directly, called concretism. They have some need in daily routine. It could happen that it is so strong that there is a kind of rigidity, so they can't be flexible. If they have a daily pattern of how they do things, they should do that every day, otherwise they get anxious or agitated. So there are many classical symptoms, stereotypies like flattering with the hands if they're excited, and being over-focused sometimes on some topics. In the Netherlands, for example, they're interested in dinosauria, in some what's the name for that? Ritter? It's
Knights.
Knights, yeah.
Oh yeah, nice. Yeah.
So about history. Some other are interested in numbers of cars or the names of cars and technical things, train schedules, like that. Things where we think spontaneously, why are you learning that?
Yeah.
Why are you interested? So they have sometimes the problem of not being habituated. That means things that other normal people would say, okay, it's nice once to know something about it, but not to keep the focus all the time on that. They are not habituated. They go on and go on to have interest in the same topic sometimes. Sometimes it is a period, several weeks, several years they do the same, and then there comes another topic, and then they're interested in that. These are the core symptoms. But autism is highly comorbid. That means combined, associated with other psychiatric disorders, like ADHD, to having an attention deficit hyperactivity disorder. So they are not concentrated at school, they are impulsive. That is often combined. Or to have some motoric problems, so they are not able to play soccer, for example, in a team. Other problems which are typical is some anxiety problems as a part of autism, or even as a comorbid second condition. So different typical comorbid conditions associated with autism. Not to forget, in the severe cases, they have epilepsy, so they are as well organic, there's a somatic disorders as well.
Yeah. It means there is no medicine specific for to treat autism. We treated the community.
In the whole psychiatry, we do not have at the moment medications who really solve the cause of a disease. We cannot give a tablet and then the brain is working and becomes better, is better connected, and everything becomes good. Impossible. there might be a future in 10, 15 or 20 years that some medication can influence the early development of the brain. I expect that, yes, so to change the course of the disease, but we have to wait some years. Nowadays we have good medications, whole spectrum, to decrease symptoms, to improve their ability to learn other things, and to decrease some behavior like aggressive behavior. You can reduce it, emotional dysregulation, or the concentration problem. You can give some stimulants so that they are concentrated. Medications like risperidone or Abilify, aripiprazole are the best working medications, even if they have some side effects, but they can change even some core symptoms of autism. Autistic children, I saw autistic children who started to speak with medication, who started to make contact with other people. So you can change even that, but then you have to start quite early in the treatment, in the development of the child. But they are all symptomatic treatments. You can change symptoms, increase positive behavior.
Do you have some strategies to give conscious to the society the importance of autism? Do you have in Netherlands
Yeah.
to teach us?
Someone who likes to give the first answer?
One of the most important things is to mention the strength. And a few former students of our school work in the ICT because they know exactly what's right and what's wrong. There's no grey between white and black. And that gears very well with writing computer programs. We have one former student who works at a publisher correcting the text. She's very focused on details, and that's what she should do. So sometimes your core symptom is your core strength. So starting with mentioning what strengths are, not the weaknesses, is a starting point for focusing on these are fellow citizens and not patients.
Yeah.
And that's the starting point. And of course everyone, as we are sitting here, has weak and strong points. So starting with being normal is focus point one. And from there on, when the youngsters themselves or the adults get tools to cope with their weaknesses, they can hide it a little. But we all focus on looking at ourselves or our weaknesses, and on the other, on the strengths. When we start working on our strong points and accept that everyone has weak points, is the starting point of a changing process, looking to capabilities and not to what is missing. And I think that's the most important message for everyone with weaknesses and strengths. So for all of us.
Yeah, we also have a National Autism Day where several institutions who work with people with autism spectrum disorder actually try to make the entire public in the Netherlands aware of actually the possibilities or the capabilities of people with autism spectrum disorder. And I think it was April 4 this year?
International Day.
Oh, is it actually international? I thought it was
April 2.
Yeah, April 2, yeah. Yeah, so that's one thing that happens as well where...
I think all around the world there's a lot of autism awareness going on.
Yeah.
The whole Light It Up Blue campaign, that everything turns blue to point at autism and to get people to think about it.
Create
to
a
read about it.
consciousness.
Yeah, exactly.
Yeah.
So I think it is happening already, and us sitting here only helps.
Yeah.
We have kind of courses started by people with autism where everyone can enter to experience how you look at the world when you have autism. I went there, it's a very strange effect, seeing the world through different glasses. and that adds to empathy for what's happening, experiencing that the world's just a little bit different from what you think the world is. So experiencing adds to acceptation. Acceptance, that's the word.
Another point is it is not the autistic person, it is a person, it's a child with autism. So please see the child in this, see the person, and this person has some autistic problems, and you can manage that. The main home message is you can do something with autism. It is not a disaster if you get this diagnostic mark, and it is not, oh God, we can't do anything now. No, at the moment you know exactly what are the problems and which is the impact at home, at school. You can do many things, but it should be a chain of services who are integrated. So the child psychiatrist has to work with school, schools have to work with the community, family have to work with schools. The community has to offer some jobs in ICT or in other companies, for example, in producing cars or like that. They will be maybe very good to work there, even better than other people. So, and even if it is the worst form with no development of language, with low mental capacity, you can do things for them to live later in a good environment with some support, some service, that they are quite autonomic, that they can care for themselves, that they cook for themselves, that they live in a house, that they have a daily routine. It is possible. There are only very few cases who have to stay over a long time in clinics or anything because they are really completely disturbed or getting psychosis and so on. But for 95%, 98% of all autistic persons, you can do so many things. You can really change the world. So this is maybe the most important message. And PICA is starting to do that. We are maybe some years in front of that. We have a highly developed system in the Netherlands, integrating special needs services at school, in the community, at youth care and child psychiatry. But okay, now we are sitting together to perform the first steps to create this beautiful future for Brazil.
Listening you, I think that we can start another phase in Latin America. Bring your model. Do you think it's work?
It would work in the Antarctica as well as in every other country. It is not depending on the place, on the country. Of course, you have to keep in mind cultural differences. You shouldn't go now to an Arabic country and to tell them we have first to treat them to develop sexual capacities. So you have to keep in mind religious and cultural aspects, of course. But in the core of the message, early detection, early service, improving the capacity of parents, giving advices to school, helping them to create special services at school. You can do that at every place. Of course, it looks like that it is expensive. You have to do many things. But I can promise you, we know that from many studies in other countries that for €1 or for $1 you have to spend, you get more than $1,000 back over the lifetime. So it looks like doing many things which are expensive, but at the end it is much cheaper if you do it from the beginning. Because otherwise you get problems later with criminality and so on that takes much more money and more disturbance of the whole community.
Of course. Preventive strategies.
Yes,
Cost
sure.
less expensive than
Yeah.
to have to
Yeah.
give assistance or to find an adult
Yeah.
don't receive any treatment, any holding. It costs a lot.
But it's
Yes.
difficult to find politicians who are able to look over a span of 10 years and longer.
Yeah.
They see their 4 years and they get elected as well, so they see their budget over 4 years, but they have to look a little bit longer because the main success, the main results will come after maybe 10 years, 12 years. It's,
Okay, you
Well,
were
let's be honest.
talking about we have a law, a special law includes the autistic people as a person with deficiency, and I have doubts if besides they got social benefits, it reinforces the stigma. What happens in your country?
Yeah. To be honest, every exclusion, every dedicated description of you're different is an exclusion.
Yes.
So you're right, but sometimes you have to start with mentioning we have especially facilities for people with autism to start the benefits. So I'm a little bit jealous about the system in Brazil that you have inclusive education. Every youngster has the right to go to a regular school. Sometimes for a few hours, 1 hour, he starts there. It's a new law in the Netherlands, just starts there. So you are far in front of the Netherlands when I look at that aspect. But you're right when you mention it's especially for people with autism. You give a stigma to people with autism, and most of the time we even don't mention it anymore in the Netherlands. Most of the youngsters with autism are just youngsters. Only when they have severe problems it's mentioned and they have special benefits. So I think it's a phase in participation.
But on the other hand, sometimes you need this kind of statement to get really budget on a national level to create new institutions or to create a service for this group of young people. And without this law, without this statement, they wouldn't get any special budgets for that. So it is about sometimes money. It is true what you said, sure. It's a risk of stigma. But we handle all the time in the last years risk of stigma for many mental disorders like psychosis, schizophrenia and so on. There is a risk that people do not understand it well. Things like what we are doing now give more insight that the spectrum is different, that we have to see it in a very differentiated way. And this is independent of budgets which we need to create a good service for this group of people. And they need any special support. The families need support in that. And not everyone is so rich to do it by his own possibilities. So they need external help. So I think the idea is good, but we have to discuss all the time to create the right picture about young people with autism.
So in fact, we apply for money for research, naming and framing it's for youngsters with autism. So we use it to get money for research like yours.
To improve, to improve the treatment and
The knife cuts on
quality
both
of life.
sides. Yeah. So you can't. I think to some extent you can't completely get rid of the stigma without completely getting rid of the benefits that they get from it. So.
That's the for me that's the mission of PICA and the partnership with Institute Julius and your institute also, because we have to put this situation in the middle of the society. Oh, you have to look. It happens. It's a fact, and we need some money or much money to create special spaces for their show for they show their potentialities instead of they have some handicap. Yeah, and in this mission we can also show to the society that if you treat, if you good diagnosis early, and you treat giving space, giving a good team, multidisciplinary team,
Yes.
like we are trying to training in PICA nowadays, we can show citizens who could assume responsibilities, legal responsibilities, affective compromise, and to be a good future.
Yeah, that's true. And today we were talking about autism, which is really important, but not to forget 30% of the whole population will get any kind of mental disorder during their life. We have many, many different kinds of disorders. More than 50% of these disorders, sometimes even 70%, will start in childhood or adolescence. So if we don't have a PICA, we will have many, many problems in adulthood. And PICA can protect many people from being a chronic patient over years and being someone who enjoys his life with a high level of life quality. This is the way of doing good services.
That's the reason I said that PICA is not a new institution, but it's a program that we want to be being followed by many other groups of society, and to receive people, special child and adolescents, to treat them, to assist them, and to give them space to develop a new project for their future in their lives.
Yeah.
Okay, I have to thank you very, very much to leave your job, your beautiful job, because I visit Julius, and it's a beautiful institution with 70 units doing one. How many cases you see per day?
We have per year in total 20,000 patients, 5,000 in the childhood and adolescence, and 15,000 in adulthood until gerontopsychiatry, older people. And we have every year about 5,000 new cases.
This is Julius, and this is the great and generous peoples from Julius who came to Brazil and give us some very important lessons to start to follow and to make difference in our society. Thank you very, very much.
You're welcome.
As you said, Genada.
Okay, thank you.
Thank you.